I'm Dr. Tara Hulbert. I'm an obstetrician and gynecologist here at Swedish First Hill. I think I've always been very passionate about women's health, which is why I went into obstetrics and gynecology. But when I had my own complicated pregnancy, it just made me really see what a vulnerable time it is in a woman's life. And so that has it forced me to really take a look at how I treat patients and make sure I'm really getting to the bottom of everything when it comes to pregnancy, the medical issues, the emotional issues, everything that comes along, and it's really helped me become a lot more compassionate obstetrician. I think that I am one of the luckiest people in the world when I go to work, especially when we get to deliver babies and be there for that very special moment. It's just so joyful. We do so many other things besides delivering babies, but I would definitely say that is the most rewarding. I really try to go through a lot of prenatal education to prepare them for childbirth and beyond, even getting them through every important step, making sure they have a healthy pregnancy and answering all questions that they have. When a patient comes to me for their pregnancy, this is going to be a very long relationship. We sometimes will be with each other for 9, even up to 12 months, depending on, what happens in their postpartum as well. So at the very beginning, I really want to get to know, obviously, what's going on with them medically and the health of the early pregnancy, but just a little bit about who they are, what they do for a living, and just, where they're from, so we can touch on a more personal level and develop a trusting relationship throughout the whole pregnancy, so they feel like they can come to me for anything. We have a wonderful OBGYN team here at Swedish. We have a large group of doctors, and we all work very, very well together, which is very important when you're in our subspecialty of obstetrics, because we often will cover each other's patients. So it's really important that I trust my team and that I know that we're all very like-minded and compassionate and treat all our patients with the same respect and compassion that I would want all my patients to be treated. We are very well equipped to deal with anything a patient might go through during their pregnancy, during labor, after labor, any surgical needs in the future. We have a great center here at First Hill and very experienced physicians, great anesthesiologists. So I just feel lucky that I work in a place where it's just so rich with resources that I can do whatever I need for a patient.